Good morning, everybody, and welcome to the Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics and emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk is the use of artificial intelligence in healthcare setting. Joining us today as our guest speaker is Lisa Prasad from Henry Ford. She is the Vice President and Chief Innovation Officer at the Henry Ford Health. She's going to highlight our viewers about the artificial intelligence and its role in the world. Global use, how artificial intelligence are being used. So, good morning, Lisa, and welcome to my show.
Thank you, Dr. Prasad, and it's just such a pleasure to be here today. I've been following Health Talk for 15 years now, and you guys have been such a stalwart for the Bloomfield Hills community. And it's just really such an amazing pleasure to be here to join you.
Yeah, and I'm so happy to have you because this whole thing, artificial intelligence, has been a new era for me to learn about,
Yes,
because being in medical field for all these years in my life, we did not have all this, but suddenly, so you won't believe, I stayed late till midnight, just reading the whole history
well,
and
you
whatever.
didn't have to do that.
How the human brain is simulated by the machine.
Yeah.
Anyway, before we get started, will you please give your introduction? We are very privileged and honored to have you today.
Yes, of course I will. My career began at PricewaterhouseCoopers many, many years ago, where I worked in the higher education consulting practice, and all of my clients were universities and health systems. And that's really where I learned how a complex organization can have such an amazing impact, not only on its institution, but also on its surrounding community. And so I've been in sort of the business side of education and healthcare for my entire career. I've been an entrepreneur, I've had my own business, I've raised a fund, but most recently for the last 10 years, I've been working in the innovation program for Henry Ford Health. And those of you who know Henry Ford know that there is a 110-year history that the health system has in Detroit and in Southeast Michigan. And because it was founded by Henry Ford, one of the greatest innovators of all time, innovation is really in their DNA. So over the years, I've worked in technology development, then I worked in digital technologies, which were all the rage 5 years ago. And in the last 4 or 5 years, much of my work has been in the field of artificial intelligence. And how do you identify those companies and bring those into the healthcare setting?
So that is very good. I'm so privileged to have you because you are educating us, the physician, about the artificial intelligence and how it is simulated with you. So, number one question, how do you see introduction? How do you see we are seeing even bleed into the healthcare? Can you highlight our viewers about that?
I can. So it's funny. Even just 5 years ago, we had artificial intelligence. Artificial intelligence is really just making machines think more like humans. So it's a tool. And a lot of our machines included AI, but it wasn't part of our ongoing lexicon, right? Yeah. So nobody talked about AI. It's really the advent of ChatGPT and some of the more the day-to-day applications that have created this I think, overhyped artificial intelligence sector. But we used to talk about this as machine learning, and we used to talk about it as data science, but now it's all under AI. So how I think about AI in healthcare is in is in three pillars.
Right.
The first pillar is how can AI help us do administrative tasks of healthcare better, right?
Yeah,
so
that
as
is
you
very
know,
important,
so you know, Dr. Prasad, from being in
Yes,
healthcare, that
right.
there's a whole back end that patients don't see. So there's the
Right.
billing, there's the procurement,
Yeah.
there's the financial side of it. And all of these processes can be improved using artificial intelligence. So
Right.
for example, AI can be used to predict which claims are going to be rejected and which claims are going to be accepted.
Exactly.
So those things make healthcare more efficient and more cost effective.
It is scary, isn't it?
It's, well, the administrative side is not that scary because it just makes us better at doing what we would have done anyway.
Right.
But that's where we're seeing a lot of really great companies that are being developed and that are proven and that are being implemented and scaled. So that's one. The next pillar that I see are technologies that I would say unburden the provider. So you being a doctor, you know that at the end of every patient visit, you have to do your notes in Epic, right?
Exactly,
Or maybe
yes.
somebody's using Cerner or they're using EMR.
It's been nights adding the notes, right?
Right. They call it pajama time, right? Because the doctors see their patients, they go home, they put their kids to bed, then they put on their pajamas, and then they finish their notes.
Finish the notes,
so it's
right.
called pajama time. So this is an area where we're seeing more and more AI unburdening the doctor. So for example, there's a tool that's being implemented through Epic right now where where the AI technology with the ChatGPT base, it will draft notes for you.
Right.
So, for example, let's say that I have a doctor's appointment and I forgot to ask my doctor something, right? So I go onto my chart and I say, Dr. Chang, I forgot to ask you. I'm going on vacation and I need my blood test done this week and I can't wait. So this is one email that I've sent to Dr. Chang, and there could be 50 emails waiting for him at the end of the day in his inbox that he now needs to respond to.
This
right?
is the priority, right?
Right. So there is one can use artificial intelligence in this tool where when that email comes in, the AI drafts a response for the doctor to review. Okay. So when the doctor logs in, they see my email and they see the response, and then they can modify the response or they can just accept that response. And just imagine how much time that saves because you don't have to type each one directly. And you know what's funny, Dr. Prasad, is that they've done tests on this kind of intelligence, and it turns out that some of these responses that are drafted by the AI chatbot are more empathetic than what the doctor would have said. And it's not because the doctor is not empathetic, but the doctor is really, really busy.
That's right.
The doctor is really busy, and they're trying to just get through their 50 notes, whereas the AI can take the time every time to draft that. So there's a lot of technologies now that are unburdening the provider. And then the third pillar, which I think is more hype and press releases than it is actual reality, are those technologies that touch the patient directly. But there are some really interesting things there. Like I recently met a company that had created a virtual nurse using artificial intelligence.
Yeah.
And
I read about that.
Do you want me to give you an example of what this technology
please do
does?
that. Yes, it's very interesting. Go ahead.
It is very interesting.
I read it, but I want to hear from the expertise. Go ahead.
So actually, they did a demo on me. So I was the patient, and they would call, and the virtual nurse calls and says, "Good afternoon, Ms. Prasad. You were released from surgery yesterday. How are you feeling today?"
Okay.
I said, "Yeah, I'm feeling okay, but my foot is a bit swollen."
Oh, okay.
So you know what this nurse says to me? And keep in mind, this is not a person. This is
just
the technology.
Yeah.
And so the nurse says, "Well, a swollen foot is actually a very common side effect of the surgery that you had. Okay. So you should just keep it elevated, and if you're still feeling the pain in a couple of days, then you need to call Dr. Chang. But how are you eating? Are you eating well?" And I said, "Well, my neighbor brought me some beef stew." And I was wondering, should I eat that? Okay. And you know what this nurse said? immediately,
Yeah.
the chatbot says to me, well, beef stew has a lot of salt associated with
okay.
it. So you really need to call your neighbor
Salt
and
and
find
edema.
out.
Yeah,
So
salt
you
and
really need to
edema.
call and ask your neighbor how much salt was used in this. So I thought, okay, this is really interesting. And then the virtual nurse says to me, well, your doctor prescribed lisinopril to you. Are you taking your lisinopril?
Yeah.
And I said, I don't know. The same neighbor came over and she said that lisinopril would give me a sore throat. So I decided not to take it.
Right.
Well, Miss Prasad, it's really important that you take the medication as directed by your doctor and you don't listen to your neighbor. So it was an amazing conversation with a lifelike voice and so much empathy. And this chatbot knew exactly what my discharge directions were.
Yeah.
She knew exactly what medications I was prescribed.
Yeah.
And she was able to hone in and answer all my questions.
Everything is already in the machine. Everything is already in that
So what the AI is doing in this case is it's learning from general knowledge from the internet, because that's how she knew that there's salt in the stew.
Right.
And it's also specific knowledge from scraping the data that's living into Epic. So she knew exactly what procedure I had and what the side effects might be and what my medication follow-up was. Now, just imagine that you can have this for every patient every day if needed, right?
Yeah.
And it's very hard with the nursing shortage to actually have people do these things.
Especially after COVID era.
Yes.
So short of health.
Yeah.
So I have been working with the Henry Ford health system almost 35 years or so. I took the EPIC courses. When the EPIC started, trust me, it was hard for me to go through the EPIC courses when the patient is there in the lobby and then with the nurse but now with the artificial intelligence, it has become so easy, right?
Well,
by the time they come to me, they have already informations.
It will become easier. I wouldn't say, it's again, it's designed to unburden the provider. But remember, the provider, the doctor, is always the responsible party for the patient.
Exactly.
So,
I agree with you.
when you say people are afraid, people shouldn't be afraid.
Exactly.
Because at the end of the day, they're not being seen by the robot. They're being seen by a real doctor who has full responsibility for their care.
Yeah. So another question from you, Lisa. There are lots of A1 technologies out there in development. So how does the organization decide which one to get? This must be very hard for you, right? Must be a hard decision for you to get which one to get organized.
It is and it isn't. So again, if you think of artificial intelligence as a tool, then it's just a tool. So that's like saying, how do you decide which area gets a computer? Every area will eventually get a computer. Every area will eventually get AI. But you have to look at, what is the strategy of the system?
Yeah.
So if, for example, the strategy is to improve population health, then we will be looking for artificial intelligence technologies for that area. If the strategy is to increase throughput of patients, then we'll be looking for AI that supports that. So you really have to look at where the hospital or the health system wants to invest.
Right, yeah. And must be hard for you to even make the decision about the proper one that will fit the whole system, right? That will fit the whole health system?
Yeah. It's a multifaceted decision-making process, just like any technology
is. So now you tell us, what are the hurdles you see in integrating these technologies? What are the hurdles you see?
The biggest challenge in artificial intelligence is the data that feeds it. So
data entry, right?
It's the data, not so much the entry, but the data that is driving the algorithms. So when AI is making decisions, it's making decisions based on millions of transactions that happened previously.
Right.
Right? So when it's telling me there may be too much salt in the beef stew. It's looking at the internet and it's looking at millions and millions of records that say there's salt in
Just
the
like
beef
the
stew.
Google search, yeah.
It's looking at
Right,
millions and
Google,
millions of Google searches. So if those Google searches are wrong or if there's bias in the data, then the result will be bias in the AI algorithm.
Okay.
So let me give you an example.
Yeah.
It's known that women who show up in the ED with chest pain are admitted less frequently than men.
Right, yes.
Right?
I read about the incident.
Yes.
Women
So-
more than the men.
Women less than the men.
Women less than the men
Yes.
for the
chest pain.
Yeah.
Right. And that is a bias that exists. And hopefully we're chipping away at that, but that's just a bias.
Okay.
So if the chatbot is looking retrospectively
Sure.
and seeing that fewer women are admitted than men, then it thinks that women should be admitted less frequently than men in the future.
Okay.
So if you're relying on that,
Yeah.
then the data that comes out on the other side to help guide you will be wrong.
Exactly.
So the biggest, and by the way, this is not just for healthcare, this is for all industries. The biggest challenge for AI is making sure that the data that feeds the AI is good. It's not biased in
Have
any
a
way.
positive attitude about that.
Well, more than the attitude, you have to keep looking at what the data source is that's
Yeah.
driving the AI algorithms. So it's there's two things that I've read about AI, which I'll share with you.
Sure.
One is that using AI is less like riding an elevator and more like driving a car.
Right.
So when you get into an elevator, you press 5 and you don't have to do anything. It's going to take you to the
It
5th
goes
floor
up.
every time up and down.
Right.
But when you drive a car, it's a more interactive
I know.
relationship that
Right.
you have, right? So you have to know where you're going, and you have to make sure there's air in your tires and gas in your car, and understand what the weather
They
is.
will remind you about the safety, right?
Right. So you can't just use AI and forget about it. You have to constantly monitor what is driving that algorithm and what is driving the results that you're getting.
Yeah.
The other thing that I always remember is AI is like having a garden. So if you curate your garden and if you water it and you weed it, then you'll have a beautiful garden.
Right.
But if you just let it sit there, it will go to weed.
Weeds will grow,
Weeds will
right.
grow.
Yeah.
So AI is something that it's a very, very helpful technology, but it needs to be managed all the time.
Exactly. I agree with you. Whatever technology, it has to be monitored, right?
Yes.
Yeah, Chink. So how can we rely on artificial intelligence? We are not even sure on the data. And also, how do we be sure about the data?
Yeah, so the data is the biggest challenge, right?
Right,
So you have to make sure, particularly in healthcare, that biases of the past don't end up being biases of the future. And you really need to understand where the data is coming from. Right now, many of the AI technologies that we're seeing for healthcare, they're being developed in Boston, New York, and San Francisco at the large.
The three area, Boston, New York, and San Francisco. Okay.
Those are the large areas for development of such technologies. So these pilots are being run in big academic health centers in New York, Boston, and San Francisco.
Sure.
And they may not have a representative sample of patients there. So, for example, Indian patients may be underrepresented. Puerto Rican and Latino patients may be
Right,
underrepresented. Black patients may be underrepresented. So you have to make sure that whatever the algorithms are that are being created has a full representation of the general population. So it is, how can you be sure? You can be sure by testing every algorithm to make sure that the data that drives the algorithm is really data that should be driving the algorithm. But at the end of the day, Dr. Prasad, what people should really know is that AI AI will be used for decision support. But again, the ultimate decision for patient care rests with the doctor.
We are on the doctors, right?
Yes.
Yeah.
Yes.
This is very good, because as much as, and when you see those computers in the operating room, how they are operating, isn't it amazing?
It is. It is. Technology has come a long way.
The technology is right, yeah. Manufacturing robots. That's what artificial intelligence are doing, right?
Well, there is AI in robotic
So I wrote
technologies.
a couple of things, I just want you to correct me. Examples in real life is like manufacturing robots, self-driving car, what you said, smart assistant to the healthcare, right? Yeah, so those are the things, it's amazing. I don't know what will happen to the future, right?
Well, so I think the future is bright, and I think all these technologies will really help healthcare. For example, again, I work in the Innovation Institute at Henry Ford. One of the technologies we're looking at right now is one of our radiologists has created an artificial intelligence algorithm where he has looked at hundreds of thousands of scans using a point of care ultrasound of patient's shoulder.
Point of care, yes.
Yeah. So he determined that you can take a ultrasound of a patient's shoulder, and there's a correlation between that and who is likely to become pre-diabetic. Now, just imagine that.
Isn't it amazing?
Isn't it amazing?
Yeah.
Imagine that you can get a ultrasound scan of the shoulder, and that helps to diagnose a disease, right? And then just imagine that.
Yes.
And just imagine that for patients who don't have access to blood draws and labs. And, I'm talking about ultrasound and diabetes, but we can talk about cancer care. And we can talk about any disease where the early detection using AI can save hundreds and thousands of lives.
That is true.
So
yes.
I am very optimistic.
Yes,
about the use of AI in healthcare.
And you are the expertise, and I'm very proud and privileged to have you on my show.
Oh, Dr. Prasad, thank
Trust
you.
me,
It's a pleasure.
It took me a long time to study this, because I have to know more. So the definition, I was looking for the definition of artificial, and I found, you correct me if I'm, this is a computer system which is capable of performing complex tasks that human mind could do. It is a simulation of the human mind, decision, reasoning, and solving the problems.
Yes.
Is that true?
Yes. It's a simulation of the human intelligence by machines.
Yeah.
Yes.
And also I learned that the first thing they were talking about in 1965.
Oh, wow.
I forget that, because by that time I was sleeping. I couldn't think. 1965.
So the AI put you to sleep.
In 1965, they had detected it. I think I was going to write it, but then I was, and another thing I'm going to ask you, the name of the person who created, listen to this, 1950 to 1956 by Alan Turing. Computer, machinery, and intelligence. And they named a Turing test on his name, which still measures the computer intelligence.
Wow.
Correct me. Isn't that true?
You know what? I'm not a historian, but if that's what you say,
right?
It must be true.
Yeah. So you have a very interesting topic here. So, what do you predict in future for your children and their kids? What do you predict? What is your prediction for the future about this artificial? How far it's going to go?
Well, nobody knows. Nobody knows. But I will tell you again that I'm very optimistic about the use of artificial intelligence in healthcare. It just allows for accelerated speed of knowledge and accelerated speed of insight. So imagine that you're able to diagnose a rare disease in minutes instead of weeks and months. Right? Imagine what impact that has on the patient and the family. Imagine that you diagnose cancer in stage 1 instead of stage 4, and what impact that has on the patient's life. So I think that AI will be used more and more for early diagnosis of these really wicked diseases that we suffer from, and what other innovations come out of it. I'm always amazed at what people are able to do.
Yes,
so
it's amazing.
it's
Okay.
but
So
it'll be
now,
good.
your final 1-minute note. What would you advise? What is your final note to our viewers who are watching you, and how do they connect with you if they need to ask any interesting question?
Yeah. So most of your viewers are likely to be patients or potential patients. And I think that they are likely wondering, to what extent is my doctor using AI in my diagnosis or in supporting my treatment? And should I ask? I think those are very fair questions that you can ask your clinician.
Yeah.
In 40, 50 years ago, if the doctor had a question about a particular diagnosis, they would excuse themselves and they would go in the back room and they would consult their books.
Exactly.
And then they started consulting
right.
their databases. And now they may consult databases that have AI built in. But it's very fair for patients to know exactly what technologies are being used in their care, and they should not be hesitant to ask. And I think the doctors should be very comfortable talking about it, because at the end of the day, these technologies are making the care better, faster, and hopefully more efficient in the future.
Exactly. I saw even in the fetus, I saw pictures of the ultrasound. They can focus it. They can do the genetic.
Yes.
Isn't it amazing?
It is amazing.
My God. Anyway, I like to thank you.
Thank you.
I like to thank our guest speaker, Lisa Prasad, who is a Vice President, Chief Innovation Officer at Henry Ford. I'd like to thank our viewers for watching me today on my health talk, and my producer and camera crews helped me produce this wonderful, excellent video about artificial intelligence, artificial and its role in the world, in the medical science and
Yes.
more. So thank you again.
Thank you. It was my pleasure.
Thank you. Okay.